educational content to help address coverage gaps and access to care challenges. So let's get started with this great seminar. First up, I'd like to welcome to the stage the moderator of our first panel, Ethan Davidoff, founder of Atlas Health. Welcome, Ethan.
Thanks, Clorinda, and welcome everyone. I'm Ethan Davidoff, the founder and CEO of Atlas Health, and I'd like to start by introducing our panel. We have Lisa Phillip, Executive Director of Clinical Operations and Infusion Services at the Sylvester Comprehensive Cancer Center at the University of Miami Health System. We have Patricia Falconer, Strategic Advisor for Atlas Health and former Executive Director of Cancer at Stanford Healthcare. And finally, we have Erin Turner, SVP of Patient Advocacy at Atlas Health. Now, before we get going with the panel, I'd like to share a short story about why I started Atlas Health. So I've been building technology for the past nearly 20 years. And some time ago, myself and my wife had issues with medical bills, but we had the resources to deal with it. However, we noticed a friend from college who got cancer posting on Facebook to raise money for her treatment, her living expenses. And when we saw this, we were a bit shocked. You know, is Facebook and GoFundMe really the social safety net for folks with cancer? We did some research, found all these programs, and just got really passionate about the opportunity to connect the dots and help people. In the early days of Atlas, when we were working hand in hand with our health system partners, and we were building out parts of the technology in the cancer centers and infusion centers, we saw firsthand that some people were frankly choosing to die or give up rather than leave their family with medical debt. We were talking about people that were not showing up for their chemotherapy appointments, people that were choosing, to suffer the consequences rather than, have their spouse forced to sell their home or deal with the financial burden. And so this has been a very incredible, moving journey for us personally at our company, the impact that we're having, what we're seeing, and we're very excited to talk about financial toxicity, the work that we're doing, what we can all do, and how we can reduce it together. So with that, I'd like to kick off the show here. And Patty, let's start with you. Patty, what is financial toxicity and what are the causes?
Thank you, Ethan. As a cancer survivor and a caregiver to my mom who had breast cancer, as well as a healthcare leader, I am really happy to be helping raise awareness about financial toxicity and its impact. So financial toxicity describes the financial hardship, stress, strain that people experience as a result of a cancer diagnosis or a diagnosis of another chronic, complex, or even life-threatening disease. It also describes the coping behaviors that patients and families have to do to manage their care and their financial situation. Management of diseases such as breast or colon cancer, rheumatoid arthritis, multiple sclerosis, diabetes, all require expensive procedures, advanced imaging, and treatment plans that include high-cost medications that are often administered over several years. So there's some surprising statistics. $433 billion that Americans spend every year to cover out-of-pocket expenses. And 25% of Americans have greater than $10,000 in debt. And 40% of Americans express anxiety over their ability to cover their healthcare expenses. Many patients finding themselves underinsured despite having enrolled in a commercial health plan. So sadly, Ethan, your story is not so unique. I remember pre-pandemic helping a 33-year-old African-American woman who had just been diagnosed with metastatic triple-negative breast cancer. And as you know, that is a very aggressive form of cancer with a higher mortality rate for Black women than Caucasian women. She was eligible for a clinical trial that could have extended her life, but she declined. And the reason is her sister could not afford to take time off work to take her to her many treatment visits. And she could not afford the transportation or childcare costs to be able to participate in the trial. So imagine what that decision was like for her. We really want to hear from all of you on this webinar today. So can you put up the dynamic polling? So as you can see on your screen, we'd love to hear from you. What is one word that describes your experience with financial toxicity? The way you can answer is to scan the QR code that you see on the screen, or go to slido.com and enter in the 7-digit number you see on the screen. So as we wait for the word cloud to populate, it's quite likely that all of us on this call have experienced financial toxicity as patients, caregivers, family members, as healthcare professionals, or industry and nonprofit leaders. So you can see this word cloud populating. Helpless and scary seem to be resonating with the group. Frustrating. Thank you very much for participating as we let this word cloud continue to populate. As we think about the impact of financial toxicity, it's clear, as Ethan described, that patients and families are making difficult choices between paying for their medicine or their mortgage, skipping doses or treatments, or as he described, forgoing treatment altogether. Overwhelming. Desperation. Thank you all. These themes resonate pretty strongly with all of us.
Yeah.
I'm going to go ahead and have you take down the word cloud. Financial toxicity is not a new problem, but what has changed is the dramatic increase in the number of individuals that are affected. And there's several reasons for this. Over the past 5 years, the number of high deductible health plans, those that have personal financial responsibility greater than $1,000, has increased 150%. And this is happening at a time when most Americans, in fact, only 40% of Americans, can afford a surprise medical bill of that amount. And another large factor contributing to financial toxicity is employment. Patients with cancer or other complex diseases experience significant employment interruptions, even loss of employment, which impacts family income. And this was dramatically amplified during the COVID pandemic, when many Americans experienced lost wages and unanticipated medical costs due to emergency department visits or unplanned hospitalizations. Individuals with chronic disease also experience an increase in non-medical related healthcare expenses. And those can be travel, food, childcare, elder care costs, and housing to be able to make it to their frequent medical appointments and procedures.
Thank you, Patty. Thank you for the overview. It's pretty heavy. There's a lot of challenges, a lot of causes here, and it sounds like, unfortunately, things aren't getting better right now, and so we've got a big road ahead in terms of making impact. Erin, I'd like to move over to you, and I'd love to hear, what on the brighter side, what programs are available for patients to combat financial toxicity.
Thank you, Ethan. So similar to Patty, as she mentioned that she has a personal connection with, chronic disease, life-threatening illness. Same for me. I actually have a son who had leukemia as a child. And so you can imagine that was very scary. And then I myself have 2 autoimmune diseases, and I've got 2 children with autoimmune. So I am not only an advocate, but I'm also a patient. So as Patty also alluded that, patients shouldn't have to choose between receiving treatment and paying those daily living expenses. So I've been there myself. Most of you might be surprised to learn there are over 20,000 programs available. Options are available for uninsured, those with commercial insurance, and those that have Medicare. There's disease-based foundations who offer funds to help cover the cost of medication for patients who are uninsured or insured by Medicare. We also have the option to help patients that have commercial insurance. They can access drug manufacturers' copay assistance programs, helping to reduce the out-of-pocket cost. There's drug manufacturers who also offer free medication for those that are uninsured or have Medicare with an out-of-pocket responsibility. And understanding the uninsured and the Medicare population are often the most challenged in adhering to their treatment schedules. We're also seeing a few trends in the market right now that complicates the process just a little bit. For example, some insurance companies might exclude medications that have a known manufacturer-free drug program because they want to avoid paying the cost of the treatment. As you can imagine, it's very confusing, very frustrating for patients. They have insurance. Why is the medication therapy they need excluded from coverage? This is another scenario of how patient advocates can access free drug programs, working closely with health systems to improve the access to care. And then, of course, I'm very thankful for foundations such as Good Days or HealthWell, who distribute funds to help patients with diagnoses such as breast cancer, leukemia, rheumatoid arthritis. These conditions require that longer-term treatment, as Patty stated, could take several years, or it could be lifelong. Rheumatoid arthritis, you're on a lifelong treatment. This puts a heavy financial burden on the patient. These charitable foundations assist with insurance copays, the premiums, transportation to treatments, and even lodging. So leading our team of patient advocates, I hear stories every day of the patients we assist and the difference we make in reducing the financial burden so they can really focus on their healing journey. These stories motivate our team to reduce financial toxicity one patient at a time, Ethan.
Thanks, Erin. So Lisa, you live and breathe this every day. Given your experience in dealing with patients' financial toxicity, what are your biggest learnings?
Thanks, Ethan. I've been in oncology over 30 years, so I've got a lot of years of dealing with patients that face this every day, and it's very frustrating. And those words that showed up in the word cloud definitely, resonated with me. Devastating. These patients are dealing with so much. It is likely one of the most stressful times in their life. They're trying to figure out how to live, and the financial piece should not be part of it. When they're fighting for their health, money should not be an added stressor. It's proven that patients that have a positive outlook do better with treatment. They have better outcomes. They have less side effects. And we need to remove those stressors from the patients so that they can have a more positive outlook. Often patients that we see are not even aware that they have a financial responsibility of their treatment until they get a bill in their mailbox. And I can't imagine walking out to get my mail and seeing that I owe this astronomical amount of money. Talk about like stress. I can't even imagine what that looks like. And it's unnecessary. I mean, think about the same patient that would go to that mailbox, open the bill. It's the same bill, but that patient has already been talked to about financial assistance and what other options that they have. It's a totally different outcome. Patients are comfortable asking how much their prescription will cost at CVS. They go to the car dealer and they negotiate a cost of a car. Patients don't think that they have to ask for their health care. And that to me is the frustrating part. It becomes uncomfortable for them to talk about money and financial issues and being able to come to somebody and say, I'm going to have trouble paying for that. And it shouldn't have to be that way. Providers need to do better to make this a normal part of treatment planning. Thanks.
Thanks, Lisa. Patty, why is it important for providers to help reduce patients' financial toxicity?
When we think about providers in this context, we're talking about physicians, advanced practice providers, which are nurse practitioners and physician assistants, but also hospitals and health systems. So definitely the first step is to proactively identify patients that are most at risk for financial toxicity. Financial hardships can cause anxiety, depression, and feelings of shame. As Lisa described, patients may not feel comfortable disclosing to their provider their financial concerns, sometimes for fear that they won't get the best treatment or the best care because of their inability to pay. And we know that financial burdens build up over time. So assessment for financial toxicity has to occur initially, but then at intervals over the care journey. While there's been tremendous advances in medical care and treatment, not all patients have had access to these advances. In fact, 40 to 70% of patients today experience financial toxicity, with certain populations at the highest risk. So individuals that are younger at diagnosis, those that come from racial or ethnic minorities, have lower household income, are single or unpartnered, or live in rural locations are disproportionately affected. But patients and providers benefit in many ways when financial toxicity is reduced. Providers want to improve outcomes. So reducing financial toxicity is linked to clinically relevant patient outcomes, such as treatment adherence, quality of life, symptom management, and survival. Providers want to reduce patients' psychosocial distress. So as Lisa described, psychosocial distress can range from mild to extreme levels, common feelings of vulnerability and sadness, to problems that can truly be disabling. Studies have shown that unresolved financial toxicity is associated with an increased risk for anxiety and depression. And providers want to improve the patient experience. Financial concerns are top of mind today for many patients and shape the patient experience. Patients with high financial distress have reduced general satisfaction of their overall health care. And I'd say lastly, providers want to increase access to care. Patients' inability to afford the out-of-pocket costs does present barriers that are associated with delays in diagnosis and also in treatment.
Yeah, thanks, Patty. And that's what we were shocked to see all these years ago, people not showing up to their chemotherapy appointments, right? So I think that hits on the access side. So improving outcomes, reducing anxiety and depression, enhancing the patient experience, and increasing access to care. Those are great benefits for providers to lead in. Lisa, you're actually working with the providers every day. So I guess the next question is how? How can they help reduce the impact of financial toxicity?
I think providers need to make this part of the discussion. They need to make it okay for patients to ask questions in a non-judgmental and a supportive atmosphere. Patients should be able to voice concerns. They can voice concerns about side effects and losing their hair or infertility. This should be as easy of a conversation as those would be. We educate patients on all of the expected side effects of their treatment and the management of each of these side effects. This should be included in that same conversation. This is technically a side effect of their treatment. So we need to be able to manage that. One of the best models that I've seen is to add financial counseling visit or patient advocates, as Erin described, on the same day of a patient teaching visit. So let's teach them about their treatment and their side effects, and let's educate them about their responsibility. Patient would leave that visit fully educated and prepared for their treatment. If there were obstacles that were identified, they could be intervened on at that time. Providers, all providers, including the APRNs, PAs, nurses, they need to become familiar with what is available out there for patients so that when they're asked, they're not, and be able to facilitate that conversation with patients. We would all do a better job. Patients would be more compliant. We wouldn't have these patients dropping off and not receiving the care that they need.
Thanks, Lisa. So Erin, you lead Atlas's patient advocacy team. I'd love to hear from you how access to patient advocates and other solutions can further help providers reduce financial toxicity.
Yes, thanks, Ethan. So in my experience, most health systems, they don't have a comprehensive patient assistance program. Oftentimes, it is those financial counselors, maybe a pharmacist, or someone on their clinical care team that resorts to searching on the internet, finding those opportunities to try to share with that patient. As you can imagine, that's time consuming. It requires detailed investigation to determine if that patient truly qualifies. This is where accessing patient advocates, who are the subject matter experts, to helps them find those patients the program that fits them the best. They understand every patient is unique. There is no one size fits all option. These programs, they change on a regular basis. Being aware of the changes to proactively assist patients helps to reduce that time to treatment. So matching the right patient to the right program does require a good bit of knowledge. You have to know who's the insurance payer, what's the diagnosis, is it a high cost medication that was prescribed? What is that medication? And what is the disease state? So with a technology enabled solution that is integrated with the electronic health records, patients are connected to the best program options available within seconds. So no Google searching. With technology such as Atlas, you can match instantly. It's so great because this is really important with those disease-based foundations. Timing is certainly of the essence to capture funds while they are available. So I want to give you an example from yesterday. Breast cancer funds opened at 10 o'clock a.m. Within 41 minutes, that fund was already closed. Now, you know how many people out there are suffering with breast cancer and experiencing this financial toxicity. If we didn't have technology and alerts, it's really near impossible to capture funds for patients timely. So providers such as Lisa, they're at University of Miami Health, rely on our patient advocate teams to help reduce that patient's financial burden, which does improve their adherence to treatment regimens, decreases their stress levels, as we've heard, and it really gives them a more positive outlook.
Thanks, Erin. So Lisa, I know you're very passionate about this, and you've implemented a variety of innovative strategies at University of Miami. How can providers proactively address financial toxicity in a systemic way?
Thanks, Ethan. Providers, I think, need to develop that infrastructure to proactively screen patients for the need for financial assistance, either with their own existing staff or with an external vendor. Partnering with an external vendor, especially a technology partner like Atlas, facilitates the screening process without a lot of burden. It is a seamless process that integrates with the EMR, so it makes life so much easier for the end user. The technology partners help to facilitate the enrollment of patients to assistance programs to help them alleviate the stress of that financial burden. I think alongside that, developing a system to screen patients for financial distress is really important. Here at University of Miami, we use a system called My Wellness Check that automatically and proactively screens patients for distress every 6 months in English and in Spanish, and it automatically refers a patient that reports an issue to a social worker so that it can be intervened on quickly. I think this is really, really a key, strategy that you have to be able to ask the questions. You have to know that there's a problem to be able to act on it. Being proactive is definitely the key.
So Patty, you've touched briefly on all the assistance that charitable foundations can provide. How can these organizations increase patients' access to financial resources?
Well, charitable foundations play a big role in providing both direct and indirect resources. In partnership with providers, charitable foundations solve many of the administrative, financial, and legal barriers that I certainly experienced as a health system in supporting patients directly. So if you think about charitable foundations, certainly we would want them to connect with patients early in their care journey, hopefully to provide educational resources and prevent a severe financial adverse event like increased medical debt, bankruptcy, or eviction. The challenge is that patients cannot only rely on healthcare providers to connect them with resources. And patients may be overwhelmed or have language barriers that prevent them from accessing programs on their own. There are several online directories, and Patient Advocate Foundation, patientadvocate.org, has a frequently updated national finance resource directory where a patient can enter their age, their health insurance, the state of residence, their diagnosis, and then select from over 40 categories of financial resources that they could be interested and eligible for. Charitable foundations offer direct financial assistance, as Erin described, copay assistance for medications specific to the diagnosis, and then a limited availability, 41 minutes, as Erin described it with that one example, of access to support grants that will cover the costs of insurance premiums and expenses associated with participation in clinical trials, housing, food, travel, childcare, even diagnostic testing assistance. Eligibility varies by diagnosis, by type of health insurance, treatment plan, and household income. Another area charitable foundations can support patients is in providing educational resources around important topics, such as employment-related issues, health insurance optimization, disability and work accommodations, financial planning, managing medical bills and appeals, and accessing charity care programs. There are many charitable organizations that provide these services free of charge, and Good Days and Accessia Health, two of our partners on our webinar today, are great examples of that. Charitable foundations also support patient advocacy and policy changes at the national level to increase access to health insurance, reduce the cost of drugs, discourage low-value interventions, have eased the financial strain on patients. And foundation advocacy for increasing funding for clinical trials, value-based reimbursement models, and coverage for precision medicine are all ways policy can increase affordability. Another emerging resource that charitable foundations may provide is access to financial navigators. So depending on your diagnosis, financial navigators may be able to provide one-on-one help in understanding and managing finances, and also help determine some health-related social needs that might not be being met, and identify appropriate resources, even assist eligibility and enrollment.
Thank you, Patty. And thank you, Lisa, Erin, Patty, for your time and information today. I mean, you've shared a ton of great information. I'm sure the audience would agree we're all much more informed. I'm very appreciative of that. We are running light on time. So maybe to end today's session, Patty, I want to go back to you. What are your calls to action for the group? What do you want our audience to walk away with?
Thank you, Ethan. Our webinar hopes to encourage patients to initiate financial discussions early in the care journey, motivate hospital and health system leaders to make reducing financial toxicity a strategic and priority, a strategic imperative, and to inspire increased philanthropic support to our partner charitable foundations so that they can support more patients, families, and programs.
Thank you, Patty. And if anybody in the audience has any questions, please feel free to email us at info@atlas.health. And with that, Clorinda, I'd like to pass it back to you and thank everybody for their time today.
Definitely. Thank you all. You know, and you touched on it very well. It's the road to getting a diagnosis is difficult. And you know, you heard the word fear and devastating. Now imagine being the individual or your child. You finally get that diagnosis, and then you learn later about the costs. You know, that's just as devastating. There might be a cure or a medication or a treatment that's going to extend life. and it may as well, be on another planet when you can't afford the treatments. So thank you all for everything you're doing on the front end. And I'd like to introduce our next panel. I have David Griffiths who is the VP of Accessia Health, and Jared Walker, who's the founder of $4. Dave, why don't we start with you to give us a brief introduction?
Yes, great to be on the call today, and appreciate everybody's time. And it's been a great discussion so far. My name is Dave Griffiths. I am the VP of Development for Accessia Health. We are a non-profit patient assistance organization. We provide financial assistance to patients with chronic medical conditions and disabilities.
Yeah, I'm the founder of $4. We are a nonprofit. We help people navigate the hospital charity care process. So we enforce hospitals' charity care policies and fill out all the paperwork, submit it to the hospital, advocate on their behalf, and we've eliminated over $26 million in medical debt for people.
That's amazing. So I'm going to get started with a question for you, Dave. Can you tell us what Accessia Health's mission is?
Yeah, our mission is serving a diverse population is one of our priorities, and that all people have access to healthcare regardless of zip code or diagnosis. We have more than 75 different disease programs. We've been around for over 3 decades, distribute over $1.2 billion to patients, helping them navigate their way through the healthcare system. And again, our main goal is to make sure that all people have access to healthcare regardless of zip code or diagnosis.
So what are the different types of assistance that Accessia provides?
So it's a very robust offerings that we have. Insurance case management, and I heard Patty talking earlier about that, being able to help people with their disability, social security disability cases. Education and financial support is huge. We help pay for premiums, medication copay, medical treatments and supplies, travel and other medical expenses.
That's incredible. Jared, I'm going to move over to you. How does $4 help reduce financial toxicity in healthcare?
Yeah, so we've created a database of every hospital in the country and their charity care policy data. So a patient can go to our website, $4.org/help, and put in, a couple quick answers to questions: household size, income, what hospital, and it will tell them immediately if they are eligible at their hospital. And then we have patient advocates that complete the necessary paperwork, submit it to the hospital, and advocate on their behalf until hopefully they're approved. And we do all of this at no charge. So that is what we're doing. Just helping patients navigate that charity care policy.
So can you explain to us what charity care is?
Yes, so charity care, I would say, is like the best kept secret of the Affordable Care Act. This is a federal law that went into place with the ACA. It requires nonprofit hospitals, which is actually most in America, to have charity care. It is their way of showing community benefit. And charity care is essentially free or reduced care for people that meet a certain income range. So hospitals will have an income threshold for charity care. And if you meet that, you fill out the paperwork, submit it to the hospital, jump through some hoops, and then you can get your medical bills either significantly reduced or waived entirely. And a lot of times it's just really hard to navigate. A lot of hospitals do not make this easy, as you can imagine. So we try to make it easy for folks.
So how do people reach you? How do people know about $4? How do they connect?
Yeah, so we mainly are connected with a whole bunch of other nonprofit organizations that will refer patients to us. It's mostly online. And then our social media platforms is where we kind of try to educate people. And then, it's like we are trying to find and partner with organizations that are also helping low-income families and individuals that may also have medical debt. So a lot of partner organizations are our referral partners.
Awesome. So moving on to Dave, you recently launched a new support approach called Your Assistance, Your Choice. How does this approach differ from past practices?
Yes, we're really excited about this initiative. We found that a lot of patients weren't actually using all the categories for all of their care. and looking at putting the patients in control of the financial assistance that we provide, we come up with Your Assistance, Your Choice, which really allows the patient to have one total assistance amount, and they can direct the funds based on the coverage they need the most. So the patient really is in full control of the donations. And when you think back to how patient assistance was originally started up, which was copay and premium assistance, over the years, there's a lot more to the actual financial burden that patients have out of pocket. It's not just copay and premiums, it's travel, it's other medical expenses, medical devices, medical supplies. And so we allow our patients to be able to make their own choice for their own assistance over the course of the year.
That's amazing. And so is it disease-based? How do people access it?
So you can go to our website, accessiahealth.org, and there is an eligibility tool where people can put in their information. Obviously, they must meet certain financial and insurance diagnosis regulations. And then once they start that process, we will ask for different documentation. But everyone needs to go to accessiahealth.org to start the process. And we have over 75 different disease programs. And like Good Days, we encourage people when they come to our website, if for some reason our fund, as Patty has said earlier, funds close fairly quickly, people can get on a wait list, or we can refer them to the other organizations like Good Days that may have openings.
Well, both you and Jared, we touch so many different people. And I know that you have stories. Is there one that sticks out in which your organization has helped and that has just resonated with you?
Well, I think, Clarinda, to be honest with you, there's countless stories out there of patients whose lives have been saved by assistance organizations like Good Days and Accessia Health. I tell you what I would like to talk about actually is my own situation. My wife was diagnosed with a brain tumor at 38 years of age. And, when you talk about financial toxicity, the white noise that you hear when you're diagnosed with a major health issue and the costs that are involved in that, it really is, as Patty said earlier, it is overwhelming for people. And organizations that like Accessia Health and Good Days and Healthwell and PAN and TAF foundations, they're a huge resource for people. And we hear stories from people who say that thanks to the help from an organization like Accessia, people have less stress, better quality of life. It's truly lifesavers for them. And I can tell you, even though at the time of my wife's surgery, which was about a $200,000, 6.5-hour craniotomy, I had no idea that organizations like Accessia Health or Good Days existed. And when you think about the overwhelming way that your life changes, we had 3 young kids at the time and had no idea about brain tumors. And it was a 3-week period between when my wife was diagnosed and when she had to have her surgery. So it's really important for me all of the time, every time I hear somebody say that they have less stress in their life because of the way a foundation has helped, and what Jared does is amazing as well with his organization. It's taking that weight off people's shoulders so they can take care of themselves, so they can actually do what they're supposed to do, which is recover from the health issue or recover from their chronic illness. And the more that we can do that, the better people are going to be for it. And I can't stress enough, as a caregiver to somebody who now is on anti-seizure meds for the rest of her life, it is a huge help and a huge burden off of people's shoulders to be able to access and be able to work with organizations like Accessia Health and Good Days and so forth.
Absolutely. And, I've said this before. When we're meeting with financial advisors or, how much you're supposed to save, I've never been sat down and said, well, do you plan on getting a life-altering disease? Mm-hmm. Your future looks a whole lot different, and certainly your financial future does. So Jared, what about you on stories that have impacted you, on the people that you've helped?
Yeah, I think one thing we say all the time is a medical crisis shouldn't mean a financial crisis. And unfortunately, for a lot of people, it does. And, we are helping people get these medical bills waived through these charity care programs. And a lot of times, the elimination of that medical bill can mean a lot. But what we see oftentimes is what that unlocks for people. So we had one person say, hey, I was faced with this decision between a medical bill because I had a medical emergency and continuing my education. And without $4, I wouldn't have been able to graduate. I wouldn't have been able to finish school. And I think that a lot of times, yes, getting rid of that medical bill and that burden is very meaningful, but a lot of times it can lead to being able to purchase your first home or continuing your education or putting food on the table, paying rent. Like a lot of these things, a medical bill shouldn't get in the way of your housing or your education or putting food on the table. So those are stories, obviously we have a lot of feel good stories and the impact that we have. We have a Slack channel with all of our staff that every time a medical bill is waived, we post it in there and we celebrate. So it's definitely rewarding work and a fun thing to be a part of.
So in 2021, you had a TikTok video that went viral. So you now have more than 85,000 followers on that platform. What impact has social media had on your mission and reach?
Oh man, TikTok that was an accident. I was not on TikTok before. I didn't have any followers. It was actually my first video that I'd ever posted. So yeah, social media has been incredible for $4. It's brought us from, an organization that started in the Pacific Northwest to a national organization that is helping people everywhere. And, our reach has been significant because of social media, and we've been able to help a lot more people. I do think that, maybe the folks that are the most vulnerable and need our services the most might not be on TikTok, which is why we've put such an emphasis on partner organizations and trying to plug into community organizations that are already serving. So social media has been incredible, and I think a lot of times people think that TikTok is just a app where people do funny dances or whatnot, but it's actually a lot of times incredible educational material. And we've eliminated over $20 million in medical debt because of a TikTok video, which sounds silly, but it can be used for good. So
yeah, not silly at all. That's amazing. So our time in this panel is ending, but I would just like to ask you if you can just provide the audience that's listening and those that are going to come back and listen, how do they reach $4, or your TikTok channel? If I'm saying that right.
Yeah, $4.org is our website. If you want to go directly to our screener, $4.org/help, you can see if you're eligible for your hospital's charity care program. If you want to follow us, it's at $4. And yeah, we'd love to help.
And so what about you, Dave?
So accessiahealth.org is the easiest way to contact us. You can also look at us up on LinkedIn. I'm very active on LinkedIn, and I think going back to some of the previous panelists, that connecting early with patients is really important to all of the foundations. I know clearly it's something that you guys do a really good job of as well, and I would urge any patients out there or patient providers to access the websites and go and connect with us on LinkedIn and find out what's going on, because as Patty talked about earlier, the breast cancer fund that they opened up and closed within 30 minutes, we've had the same issue. We recently opened up an asthma fund that closed within a couple of days. There's a huge need out there, but being educated and being up to date on what the foundations are doing is always a bonus for people. So accessiahealth.org, and certainly look myself and or Accessia Health up on LinkedIn.
Yeah, I certainly think that we certainly all play a role in ensuring that we remove the burdens. As when somebody calls any of our organizations, unfortunately, we are the most educated. So ensuring that they get to a place in which we can relieve their financial burdens. And again, whether it's at Good Days or going to $4 or going to Accessia Health, in the end, it's the people that we care about and wanting to ensure that they continue treatment without the toxicity, financial toxicity.
Exactly. And I tell people all the time, I'm very lucky in that when my wife was diagnosed, we had good health insurance. But if we didn't have proper health insurance, I'd be bankrupt today.
Mm-hmm.
And her medications are really expensive, and they're life-saving medications. If she didn't have her anti-seizure drugs, she would have a seizure within a day, and they're very, very expensive. And so, as you said, we understand as foundations, as organizations that are helping patients every day, we understand that that's our main goal, is to put patients first. That's what we're here for.
Absolutely. Well, thank you very much, both of you all, for your time today.
Thank you for having us.
Thank you. All right. Well, next up, we're honored to have remarks from Stacey Sanders, who is counselor to the Secretary of Health and Human Services. Stacey joined the Health and Human Services Department after 5 years in the U.S. Senate, where she mostly served as staff director of the Senate Special Committee of Aging. Stacey will share information on how the Inflation Reduction Act addresses coverage and access issues.
Thank you very much. I'm Stacey Sanders, counselor to the Secretary at the U.S. Department of Health and Human Services. I'm delighted to be here with you today to discuss an issue that's so important to all of us. Before I dive in, I want to thank the Chronic Disease Alliance for hosting this event. I'm proud to be part of an administration that is investing in America and fighting to strengthen Medicare for the next generation. We're working hard to bring down healthcare costs so that American families can sleep better at night and make their monthly budgets work. I'm also proud to work with Secretary Becerra, who has made it a priority to ensure no one is left behind and that every American has access to quality, affordable health care. For more than 50 years, Medicare has been integral to this country's healthcare system. And today, we are here because we are working to strengthen Medicare for the next generation. The President's new lower-cost prescription drug law is the most consequential piece of health legislation since the Affordable Care Act. This law has many important provisions to help lower healthcare costs, including a $35 monthly cap per insulin prescription in Medicare, free recommended vaccines for those with Medicare prescription drug coverage, and the ability for Medicare to negotiate the cost of some prescription drugs. Many may not know it, but the cap on insulin costs and free vaccine provisions have already gone into effect. Scores of people with Medicare across the country are already benefiting from the new law and have more money in their pockets each month because of it. The potential benefits of the law are huge. Earlier this year, we found that in 2021, 3.4 million people with Medicare Part D paid $234 million for recommended preventive vaccines, like the one for shingles. Had these out-of-pocket costs for covered vaccines been eliminated in 2021, people who received vaccines under Part D would have saved nearly $70 on average. These savings are in addition to the $35 monthly insulin cap, which would have saved 1.5 million Americans with Medicare an average of approximately $500 on their insulin in 2020. That adds up to $734 million in Medicare Part D and $27 million in Medicare Part B, and greater peace of mind for people who need insulin. Thanks to the President's new lower-cost prescription drug law, Medicare beneficiaries will be able to better afford many medications like insulin and even get recommended vaccines for free. That's real savings, better health, and better peace of mind. President Biden and this administration put people first. If you need proof, look no further than your receipts for the cost of your vaccines, your insulin, and soon some key medications on the market. Help take charge of our healthcare by reaching out to your networks, to your communities, to trusted messengers, and let people know of their options to access these important benefits. We all know how important it is to protect our health, access care, and save on the cost of prescription drugs and vaccines. Help us spread the word and get the message out to your networks. Thank you.
Thank you, Stacey, for participating in this webinar. I'd also like to give a special thank you to Atlas Health for sponsoring this webinar and also for the expertise on your panel. Once again, I want to thank the audience for joining us. And again, feel free, if you have any questions, to send them over to the team. You could also reach Chronic Disease Fund at chronicdiseaseday.org, sorry. So you'll visit us on www.chronicdiseaseday.org. For Chronic Disease Day, we'll be sponsoring many events coming up. The first one is on July 10th. So again, we welcome you to Go to our website and learn more about what we do. Thank you to all of our partners for joining us today, and I hope that you found this webinar helpful. Thank you and take care.